Okay, welcome everyone. Thank you very much for taking an hour out of your afternoon. I know you guys are very busy, but today we actually have Paul Bernstein, Medicare broker specialist from Health America Coventry, presenting the 2014 details for the upcoming open enrollment. He's going to go over a couple of strategic techniques as far as phone sales, things that we've been going over in some of my previous webinars for those of you that are interested. At the end of the webinar, this is going to probably run about 35-40 minutes. At the end of the webinar, if you have any questions specific for Paul, please type your questions in, and I'll do my best to get as many questions answered. For those of you who do not get your questions answered, you can either contact myself or Paul. I'm sure Paul will give you his contact information at the end, and we can get those questions rectified before open enrollment. All right? And Paul, without further ado, I'll hand everything over to you.
Great. Thank you so much. And just before I get started, I just want to make sure, as far as the screen, is that something that I am in control on my end, or is that something that you're in control?
Yes, you're in control. I made you the presenter, so you're ready to go. They see what you see.
Right now, I don't think I see the presentation. Am I missing something here?
No, I mean right now it's the home page right now, so they should be. You're the presenter, so you're in full control now. You got to show your screen. You got to press Show My Screen on the top.
Okay, give me 1 second while I load this in.
Sure.
Okay, great. I just want to make sure everybody can see it okay?
Yep, everything's
Great.
good. I see it perfect.
Great. So thanks for joining, everybody. My name is Paul Bernstein. I'm the broker manager basically for Eastern Pennsylvania. From what I understand, most of you are from possibly the Central PA. I'm filling in for Amy Knight Curran, who generally handles the Central PA. I handle the Eastern PA. But at the end of the day, Health America, Coventry Health America is spread across Pennsylvania into Ohio, and we're expanding into Western Virginia. So, the good news is that if you're with us previously, there's very minimal changes from last year. So when we get to some of the benefit portion, there's just some positive changes and very minimal changes. So I don't think it will be very confusing, and there's not a whole lot on that end. So as we go through, I think we maybe want to keep the questions to the end if possible. And obviously we'll have, in this presentation, you'll see some contact information, not just for me, but some other avenues, maybe like for Amy for Central PA and some other things. So we'll get through it, and my goal is to keep it, approximately about 30 minutes or so, and then we'll open up for questions, and then I know everybody has got some work to do, but I do thank everybody for joining, and with that said, let's get started here. So obviously this is the same presentation, just I'll make sure everyone's aware. We've done some kickoff events over the past couple weeks. I personally have been doing it more in the Philadelphia area and surrounding, and northeastern PA, and Amy does more central PA. So it's basically the same presentation and same information from one of the kickoff events, which I'm guessing a lot of you have not been able to go to. So what I'm going to go over today is just a little bit about the service area or value proposition, just what you need to do to make sure you're ready to sell, servicing your clients, product information, and just basically everything you need to get going now. There's obviously a lot more details and things like that, but like I said, the goal is to introduce you, point out some of the things, and if there's anything of further interest, you can reach out to myself or Amy or some of the other resources which I'll show you. So as far as a service area, like I mentioned, I think we're going to focus today essentially for the 5-county Philly area, central Pennsylvania, up to the northeastern PA. You notice a little bit of the shading area, Blair and Huntington. Those are actually expansion territories for us. If you're not familiar, our affiliate in 5 County is actually, last year was our first AEP, and I got to tell you, I guess it could have went a couple different ways. It could have went down, could have stayed sort of status quo, but I got to tell you, it has just been growing tremendously, and I'll kind of touch on that a little bit, just in case any of you sell there currently or would like to maybe do some marketing in that area. And there's a lot of positive reasons why you maybe would want to. And obviously, Western PA, I have some contact information as well. We're very strong out there, as well as Central PA, just because we've been in those markets for such a long time. So as far as product information, I'm just going to touch on real quick, in no particular order here, Bucks, Chester, Montgomery, and the Philadelphia counties of areas. I'll just say this. I believe we're the last standing zero premium HMO in all 5 counties of Philadelphia. There used to be, probably a lot of you have heard of another company, begins with a B. They've sort of been the king of the zeros, but I don't think they longer any are. And there may be another major carrier that I believe are in 2 counties. But, we've got a very solid zero premium HMO, no referrals, which I think is pretty important. We still have no referrals. And the key things on this page I'll say obviously is the inpatient, $195 per day, 1 to 6. On the Gold PPO, I'll just say this, our premium for $72. A lot of people like the inpatient per stay in network, $400 a stay. And really the big change from last year to this year, and this is the one thing I'll just point out, is you can do that same inpatient stay, you can do it out of network as well. So basically, it gives you the opportunity to go to any hospital, sick or surgery, and pay that $400 per stay. And on top of that, if you notice up there where it says deductible, it's a little misleading, but that's the way CMS likes it. It's a $50 annual out-of-network deductible. So where that will come in a lot of times, especially with the providers, if you want to see that specialist or whoever that may be, you're only going to pay $50 annually for the deductible, and then you're going to pay 20% of what the cost of the provider is. Maybe it's I don't know, it's an expensive specialist. Let's say it's $200 or something like that. So, you'll pay $50 and then 20% of the costs. So it's very comparable, believe it or not, to a lot of the in-network type provider opportunities that are out there. So we're very excited about this out-of-network benefit. So a PPO for $72, no drug deductibles or anything like that. You can see some of the copays. That's the big addition this year. Other than that, in the 5 county area, not a whole lot of changes. I put like an asterisk mark there where the $275 is for outpatient surgery. But if you were comparing it and line it up to last year, very minimal changes. Our goal, anytime you see gold, and this is pretty much across the board, plans all over the place for us, especially in Central and this area and Northeast. Whenever you see gold, usually means there's some sort of ancillary type benefits. In this example, you'll see down there at the bottom, dental benefit. We're still in the process of updating our dental benefit. We've had a very strong one last year, and we're actually making some upgrades this year. So it's going to be a little bit more of a per dental benefit as opposed to a comprehensive. For example, last year we had $1,000 in comprehensive. We've actually made some improvements on that. So we're excited about that. So that and the routine hearing and the vision, that's usually what's included on the gold plans. I'm not going to spend too much more time in the 5 county area. Just be aware, if you're in Philadelphia specifically or Delaware County, the copay inpatient per stay is actually a little bit less. It's $350 per stay, and same thing on the out-of-network. It's another $350. So we're very competitive in Philadelphia in the 5 county area, and I could say this. I have no problem saying it. For the money and the benefits, we cannot be beat. And I think a lot of time it just comes down to, hey, is the provider and network. And, we had some challenge issues, I think, on the hospitals last year. There was 2 or 3 main ones, but I do think this out-of-network benefit is going to help tremendously. So just keep that in mind when it comes to that in Philly and the 5 county. Briefly, some of you probably are familiar or may not be familiar with this plan, but this kind of starts out in the Wilkes-Barre area and does scatter into certain counties in Central PA. This is an amazing plan for the money. I think this was really launched at some point to compete with, especially some of that Geisinger County up there in Northeast and Wilkes-Barre, to make it a very, very difficult decision for a potential member. So I don't know Geisinger a whole lot, but they have great facilities up there. But basically, you have the option to line this up to a plan like that and show them this Gold HMO, 0 premium, 0 deductible, $300 per admission, max per 3, unlimited days. You'll see very affordable type copays, anywhere from your radiologies and your lab test zero. Some of your upper end you'll see there, radiology, MRIs, CAT scans, $145. So this is one of our few HMOs where we actually, as you'll see there, where we're going to have a full dental benefit as well on our HMO. So you're talking about almost like that gold PPO, but for $0 and all the bells and whistles, and that's what this is meant to be. So, take a look, and we'll talk a little about providers in just a few moments, but, it's one of those things you line up and you say, okay, do you want to spend that money and go to Geisinger, or would you pay nothing and have all the bells and whistles and pay nothing? So something to think about. Now we're getting into Central Pennsylvania. I know a lot of you are from there, and like I mentioned, Amy Knight's our Central PA rep, but, I'll just touch on this. Like I said, there's been very little changes. We have our Silver PPO for $0, our Silver Plus PPO $49. That may have gone up a few dollars. Our Gold PPO for $99. Some of the highlights, more especially on the, inpatient stay, you see there on the Silver Plus and Gold, $275 per admission, $300 per admission in network on the Gold PPO. Some pretty low primary office copays, 10, 5, and 5. And, one thing I'll touch on in just a few moments, but if you notice on the prescriptions, and this does apply actually across the state, this year we introduced what's called our preferred pharmacies and our non-preferred pharmacies, and I'll touch on that a little bit in just a few minutes. But the bottom line is if they go to a preferred pharmacy, they're going to have lower copays. And you notice on the Gold PPO, you'll see the coverage in the gap as well. So, like I said, I wish I don't have a whole lot to say because there hasn't been a whole lot of changes. But if you end up having some specific questions on, just certain benefits or whatever it may be, I think that might be best served maybe even, for an answer question or even privately via phone or email after the call today or, anytime during your convenience. So. Just a couple of things here. Like I mentioned, there's an asterisk there next to, we see some of the outpatient surgery copays have gone up a little bit in certain areas. But, for the most part, you see low copays across the board. If you're new to us, like I said, I'll tell you, we've been in Central PA and Western PA for so many years. I highly doubt there's really many facilities or doctors that are not in network. You find, and we'll talk a little bit about networks, but when you're in our network, it doesn't matter if you're HMO or PPO, you can use anybody in our network. So let's say you live in Hershey and you want to go to a hospital in Philly, or if you're in Philly and you want to go to Hershey or out in Western PA, you can do that. That's our network, and you can use any of the hospital or doctors in our network. So just to finalize some of the Central PA benefits, like I said earlier, and whenever you see that Gold PPO, you're going to really get more of the comprehensive benefits, especially with the dental. You see there's some hearing aid coverage as well, and you always get the eyewear every 2 years, $150 on that. So if you have any questions on these benefits, we can go over that a little bit later. But we haven't officially released any official product grids as of yet, so keep a lookout on that, and I could certainly get you a copy of this presentation. That I can certainly get you, whenever you're ready or at your convenience. What do I want to move into now, and I'm really excited about this, and many of you, if you've been with us or not been with us, may not know because we never really did a real push on it. As of January 1st this past year, we launched our special needs plan. It's called Adventure Cares. It's for full duals. It's not a chronic condition. For those who are full Medicaid, as you see here, it's 47 counties. Be aware it is in the 5-county Philly. It just hasn't been updated as of yet. So it's great that we're not, that we're in most of the counties across the state. And I'll get into some of the highlights of it in just a second here. But I got to tell you, we've made some great changes. If you were selling it last year and we didn't really market a whole lot, we've come a long way even with this. Some things to think about. It's a zero plan premium across the board. Somehow or some way this past year there was a couple dollar premium depending on the county, but it has now gone away. We've also going to be changing the dental insurance with this. We haven't updated yet, but the one thing I know we have changed as of now, and we'll be releasing in the next week or two, is it is a per benefit service, and I'll give you an example. It's going to have something to the extent of 2 fillings per year, 2 exams per year. The one part of it I really like is that's going to have dentures included in it. So I'm really excited about the dentures, and you'll see that, like I said, in the next week or two. You'll see the $200 eyewear every 2 years. And this is probably my favorite. I know it's a lot of favorites for a lot of the, certainly the members. Well, this past year, we had an over-the-counter benefit. And what that means is you almost get, it's like a debit card. It's like a flexible spending account that they can walk into the Rite Aid or some of these particular pharmacies, and it's essentially free money. You can't buy anything you want, but it will automatically update if you're going to buy certain over-the-counter medicines, creams, or whatever it may be. You can't buy cigarettes, and it was $20 a month, and a lot of people like that. It's a use it or lose it by the end of the month. This year, it is now going up to $50 a month, which I think is a really generous, I mean, it's not a catalog. You can go to some of the major facilities, and it's a free $50 a month. I tell people, I say, hey, send your members to Rite Aid. I think it's the first Wednesday of every month. I think it's 20% off. Really, it's an extra $10 or an extra, if you want to look at it that way, an extra $10 of benefits. So real excited about that. The members seem to like it, and you'll notice there the hearing aid benefit as well, $1,000 allowance per year, and our general silver and fit, which I'm sure a lot of you have heard. This is kind of interesting as well. Here is the 14 meals after getting out of a hospital or skilled nursing facility that's delivered to their home or house or apartment. It's served on dry ice. Certainly not like a Morton Steakhouse, but from what I understand, a lot of the employees did try the meals and are served on dry ice and whatnot. So a lot of the members seem to like that as well. So, like I said, this is our new special needs plan. It's got a lot of solid activity, and we're real excited about what to come. When you get into providers, I already kind of mentioned a bit on how we're one network across the state. So as you see some big names here, and I guess it really doesn't matter where you're located, as you can see, you have the option to use these. I know it can be difficult a lot of times for members, but when you see like the Cleveland Clinic here in Ohio, which we expanded, I know they're very well known, at least for their oncology. A lot of other areas, you see like the University of Penn, Hershey. So, bottom line is, it's a wide open network, and it doesn't even matter if you're in the HMO. You stick within this network if you're in the PPO network, and obviously we have some pretty good solid out-of-network PPO coverage as well. You'll see at the bottom our Coventry-Medicare.com. If you haven't been there before, and you certainly should go there, especially as a broker, you always want to make sure you're registered as a broker on the broker portal there, because that's where you would normally do your AHIP, or at least our Coventry core. And I'll talk a little bit about testing in a few minutes, but there's some good My Online services for your members, so do spend some time there on the website there. Value proposition, just the only thing I'll say on this is if you've heard of us or haven't, Coventry is the national company corporate structure, and then underneath is our company like us, which is Health America, which, for example, we handle our plans regional, like Pennsylvania into Ohio and West Virginia. And there's about 20 or so other plans across the country, like Altius, depending on where you live. So, high quality network, and we take an approach. Instead of adding like every single hospital, for example, we try to keep the benefits low, benefits high, the premiums low, quality care, and and that's sort of our goal, at least up until this point. So just keep that in mind, and that's our strategy. So as far as what's new for 2014, a lot. To sell. Before you even attempt to sell, is you always want to make sure you can print your AWN card in the broker portal on the left-hand side. Okay? So if you can't print that, and even if you can print it, just make sure you can read what's on it to make sure you're certified for 2014. We used to, I think in the past, used to mail the cards out. But for now on, just make sure you can print it, and that will make sure you're ready to sell. So make sure your contracting is up to date. Make sure your E&O is sent in. It's almost like having little light switches. You kind of switch to make sure. You want to make sure all the ones are switched up before you sell. and probably the best thing you want to do is contact the broker services department to make sure you are covered on that area. And I have a slide on there with the phone number in there just in case you haven't done it. But just keep in mind we have our UAHIP. It's called the Coventry Core Online, which is right there next to the AHIP. And this year, which is brand new, I'm sure a lot of you probably had a lot of questions. It's called our local testing. So if you weren't able to attend one of our local trainings, wherever in Pennsylvania, we can get you that, and we're working on getting you that to you via email. It's very easy. It's only about 20 questions, and it's meant to be very easy. You can do it online or fax it in. So be on the lookout for that if you haven't done it as of yet. And this is what I'm talking about. It's 20 questions, 90% or better, but I do promise you it's very easy. So just in summary, with our product strengths, like I said, we're HMO and we're very PPO focused as well, especially in the 5-county Philly area. I think we're the last one with an HMO 0 premium in all counties. I think we're probably reaching for right now more like about 86,000 members statewide. So we've got one of the strongest memberships, if not the, across the state. We're certainly reaching for higher. I got to tell you, there's some good. I'll just leave that we have got some good things coming on the STARS ratings, in my opinion. That's what I think is going to happen in the next couple of weeks. Even though shouldn't be talking too much about it, but just keep an eye out. Our STARS ratings have always, at this point, as far as is around 4, is 4. So, but look for some positive changes on that as well. Health club facilities, I'll say this. If you're not familiar, obviously there's 2 major ones, the Silver and Fit and the Silver Sneakers. There is a lawsuit, I believe, that was just finalized. There used to be exclusiveness to gyms, but look for an openness on the gyms, and because now you can belong to more than one and it's not exclusive. So I tell this at my meetings. I say, hey, listen, if you think there's a gym that will help you get members, and it doesn't matter what they were previously, which program they're part of, shoot me or Amy or someone an email, and we can put that on our list to work on it. Because sometimes people do. That's obviously a big part of whether or not they decide to join. So keep that in mind. Prescription drug coverage, all plans. We don't have deductibles on drugs on any of our plans. And like I said, usually when you see our gold plan, that usually means there's dental benefits available on the plan. So real quick, preferred pharmacies. I mentioned this is new this year. So you see, especially CPA and CEPA, you see CVS, Walmart, Kmart, Rite Aid, Costco. Cardinal's like your mom and pop type pharmacies, maybe like Medicine Shop, and there's probably hundreds of other. If they stick within those pharmacies, like I said, they'll just get a lower copay. It shouldn't be too difficult, and there's a little bit of a differentiation there, as you see there when you start getting into Western PA, Ohio, or West Virginia. So it's just another avenue to save your members money. I already talked about most of this, health club memberships, the dental and the vision, the hearing. One thing I did forget to mention, on a special needs plan, we didn't have this last year. We did add a transportation benefit. We have 48 one-ways, which we did not have last year. So, like I said, if you don't do special needs, I got to tell you, it's a great way to make additional money and create during the lock-in. And in just a few moments, I'll share some great tools that we have to even really help create special elections with financial assistance and things like that. So just give me a moment. We'll go into that. So just like I said, I don't want to say a whole lot on this. As you know, we were bought by Aetna. I mean, it probably closed this year, but it started happening about a year. There are no changes going on right now. In the future, who knows? But if you don't know, Aetna bought us basically for our government business, our Medicaid or Medicare. That's really what we do so well. But there's, enough. They're completely separate products and completely different distribution. So the only other thing I'll just point on here, you see there, Coventry pays 10-year commissions, and we have a very good member retention rate. Just a couple basics, and you probably see this a lot on most of the carriers. Just keep in mind, there is a verification call about, within the 10 days after receiving an enrollment form, just to make sure that they understand their plan. If they don't get them after the second one, a letter goes out. One thing I always say, and I don't know if this has happened to anybody on the phone, but sometimes, applications do get, I'd say, canceled by the member sometimes during verification call. I usually find a lot of those can be saved just simply because they maybe you know what, they didn't understand what that person was saying or whatnot, but if you can prepare your potential member or member that you signed up, what questions are going to be asked and to go over them, I think that would decrease a lot of those issues. So, you know, reach out to me or Amy. We can get you a verification script, and that could be something you could go over with them and eliminate any sort of possibilities. ID cards and member kits were very similar to every other company. Nothing's changed. Your welcome letter, your evidence of coverage, your formulary drug list, provider pharmacy directory does get sent. So pretty standard with most companies. Our care coordination programs, we're very, you know, like I said, we really do work with the members to keep them healthy. The only one thing I do want to point out on this page, if you see at the bottom, it's called the Matrix Health Assessment. Once a year, the member will get a call from a nurse practitioner. If you're not familiar with a nurse practitioner, it certainly is different than a nurse. A nurse practitioner can actually prescribe medicine. I'm not saying they're there to prescribe medicine, but they're there to review the medications. There's no cost to the member. My personal opinion, I think it's a nice little selling point because, hey, you know, why not? If you can have someone come out and there's no cost and they'll spend about 45 minutes with the member and perform a health assessment, hey, there's no cost, why not? So keep that in mind, and I would also let your member know that they do that just so they don't think it's some sort of fraudulent call or something to that extent. Now, one thing I really like about Coventry, which I think we do, you know, different than a lot of other carriers, we've got great programs. I'll just mention this. Altegra is a brand new one. I have yet to start anybody on it as of yet, but I will just say this. It's a service that will help qualify a potential member for any type of financial assistance, especially like LIS. It could be certain levels like your QuimBs and SlimBs and, you know, any order assistance towards your Part B or Part A premium. You as a broker can have access to a broker portal. It's very easy where you just plug in your information will automatically attach, but the member's information, and it's almost like your own little personalized team that will call them, take them through the application process, see what they might be eligible for, help them file the application, and follow up with what they've qualified. So it's almost like your own internal, if you want to call it like a sales team. This will be great, especially when, you know, who wants to sit there and pick up the phone and try and do it yourself? You can have somebody do it for you, and this is even better during the lock-in during the year, because who knows? You know, it's hard enough for any of us or members to know what they might be eligible for or keep up with programs. They will take it and do it for you. So this is called Altegra, and if it's something of interest, I do have some information on how it works. You can send me an email. I'll get it over to you, and if you're interested, in the next week or two, we can get you set up in the system. Benefits checkup, this is really we had this last year. I'll just say this, it's similar to Altegra, but it's more informal. It's a more of an informal check of different types of benefits that a member or a potential member can be eligible for in a zip code. It's not always income driven, so it could be by zip code. For example, it may say, okay, Merck is offering free copays for 6 months in this zip code. If you take this particular drug. So you can look, if you need to spend about 10 minutes or so with a potential member, and it's not all health care. It can be, like you say, down at the bottom, utilities, money for taxes, it could be free library cards. I mean, it's everything across the board, and it has links for applications and things like that. So do take a look at it, and it has a great feature to create PDF reports for the member or potential member. I'll just say this one last thing. I like it for referral basis. I've seen brokers, I've sat there and watched them actually print these up at like educational type events because you can't give plan specifics. And hey, you give these reports. I mean, if you save them $1,000 to $2,000 every year, you can be sure you're going to get referrals coming your way. Ad Builder, we have an online portal for our brokers to instead of for CMS compliant advertisements, it could be like you see there, flyers, postcards, newspaper ads, black and white, generic. So no need to have to file. Once you go in there, you can pick the template you want. You plug in your name, your contact information, whatever you want as far as personalizing certain aspects, and you'll have a PDF on your desk. You know, it will send you an email to you, and you can reproduce them or do whatever you want. So you can actually do this with the benefit checkups, for example, which is kind of neat. And, you know, you're probably going to be adding some more for 2014 over the next 4 to 8 weeks as well. If you don't have access, you should get access when you get contracted. You know, shoot me an email, and I'll get you the appropriate contact number and portal so you can get access to that. Just servicing the member, and like, you know, just keep in mind during, you know, the AEPs and, you know, in open enrollment that we have extended hours. You see down there October 1st, you know, 7 days a week, 8 a.m. to 8 p.m. When it comes to the pharmacy, those type of numbers are best served on the back of the ID card. I already talked a little bit about our Coventry-Medicare.com, my online services. That's where a member can, access your evidence of coverage and your summary of benefits. So, like I said, if you haven't done that, gone to the website yet, do go there. I'll talk a little bit in a moment about our plan finder on there, because you can look at our variety of plans on there, as well as it's good for plugging in the drugs and formulary to help your members, as well as our provider search is on there. I will always say the provider search online obviously is quicker to update than a book, but I will say this: if you sell our special needs plan, you cannot review the Medicaid doctors for that plan online. It has to go through the book, because the book will have an asterisk next to the provider or the hospital if they're part of our special needs plan. So just keep that in mind if you do special needs. You probably have seen so much of this by now when it comes to compliance. The only thing I'll just repeat to you, for scope of appointment, 48 hours in advance when practical, when you want to get it signed. If it's not practical, just write down on the document or on the scope why it wasn't feasible, and that will be okay on there. We do have our own scope. We can use ours or the CMS model. It's fine either way with us, but we have ours up on the broker portal if you want to use it. I'll say, and I'll talk about this in a minute or so, we do have an iPad app, so if you submit applications through an iPad, you do not have to send the scope in, but please do send the scope with an application. It needs to be faxed along with it. And a lot of these things, I know you've seen in your AHIP already. You need to maintain it for 10 years. So if you have any questions on any specific procedure with scopes, you could always reach out to me or Amy. I'm sure you've seen this as well, where you can get more information on marketing and guidance, and I don't want to spend too much time on that. I will say down there at the bottom, we do have a great sales video presentation that's not just for seminars, but one-on-one. We had a great one for 2013. I'd say it takes about 60% of the CMS compliance out of your mouth. It can be done on that iPad app, or it can be loaded on a desktop, or however you want to do it. So I haven't seen a new one yet, but I believe that will be out in the next 2 weeks, and it works great. So you have your formulary in your presentation, your summary of benefits, multi-language insert, your plan stars rating. This all comes in a kit, so it's not like you have to put it together. And just be aware, on our sales portal, you can order separate applications. You can always do it that way. But if you want the video, just let me know. A lot of times we just send it out on like a flash drive or something like that. Just some application do and don'ts with us. I'd use the cover sheets that are in the broker portal, because they already have the fax number, the proper one, on there already. One thing I'll say, and it's probably on the next page or two, is just make sure, and I'll touch on this in a second, is just make sure you get that application in within 48 hours after you sign it. And I'll talk about that in just a second. Even if you do a 0 monthly premium plan, make sure you mark off a payment method on there. That's important. And one thing I'll say is, don't forget to send the checklist. I see that a lot holding applications, meaning it's a checklist. It just talks about what type of enrollment period. Is it an SEP? Did the person move? Is it open enrollment? So please do that. Even though we don't have referrals, we ask that you write the appropriate physician information down. It's not mandatory, but we just asked that you can possibly do that. I was going to wait a little bit to the end, but just be aware, we do have an enrollment website for members to sign up on our plan finder on the website. Doesn't allow you to put your name, but it does have a spot there for the agent writing number for you to get credit. I'll talk a little about that in just a few moments, but I just wanted to make sure that you're aware that we have it. And just make sure, like I said, you get the effective date so there's nothing that holds up the application. And like I said, if there's anything that's really important from a Coventry, the application has to be sent faxed to Coventry. Don't mail it. There's nowhere to email it. 48 hours. So if you take an application on Friday, you're going to have to fax it over the weekend. And I'll say this, if you ever leave an application with somebody or you mail an application, do not sign your name and date it, because they could hold it and they could wait 2 weeks and then send it in, and you're going to get the slap on the wrist for it. So just print your name and write your agent writing number. You don't have to sign it, and you'll still get credit if they either mail it in or they mail it to you, however you get it. So just keep that in mind. iPad app. This is brand new. It's great for turnaround time. I'll say this. It's getting enhanced every month as we go. I know a lot of you may be thinking, hey, do you have that on Google Android? And unfortunately, it's no. It's just the iPad. So it's increased turnaround time. It's got all built-in sales presentations, videos, summary of benefits, things like that, presentations. What it doesn't have is that you do need to have Wi-Fi or a data plan in that potential member's home to do it. So just keep that in mind. So you can still use it. You just wouldn't be able to do the application in real time, but you could still use it to show the videos and look at some of the PDFs. But it's great for the turnaround time, and you do not need to send a scope in if you use the iPad app. I will tell you that. So maybe that's a little bit less a hassle. You do need to hold on to the scope, but you do not have to send it in. If you want to get started on this iPad, the first thing you will need to do is just either send an email or call to our broker services. They'll get you set up in the system. And depending on where you live, what I would recommend is give it a couple of days to get set up, and you can reach out to me or Amy. We can get you some training materials on it and just help you any way that you may need to get started. But it's meant to be pretty easy. And it's not an app that's on the iPad Apple area. It's just we have a special website we have to send you to get that. So broker services, I keep talking about them. They're great for like your commission questions, contracting, broker portal, website support. I wouldn't call them for benefit questions. That's for that customer service number there. You see 1-800-290-0190. But there you go below down there, the broker support at cbty.com and a phone number. They're good for that, especially like I just mentioned, if you want to get started on the iPad app and just some general questions with the broker portal and getting certified and things like that. Just don't call them for benefit. You're not going to get your best answers there. Producer manual, I've never really cared much for them, but I got to tell you, ours is very good, especially for some of those off-the-cuff answers you may need immediately. I would take a look at that. There's a lot of good information that's in there. Important here, like I mentioned, my name is Paul Bernstein. I'm the Eastern PA. There's my phone number and my email address. I mentioned Amy, who handles Central Pennsylvania. If anyone wants to do business out west, that's Janine. She's brand new. You see for Ohio. And the other person I would recommend you could always be in contact with is Don Mazza. He's based out of Harrisburg, and he's really handles Central PA and Eastern Pennsylvania. He's a brand new director of sales with us for over the past couple months or so. So these are our local resources and contacts. I don't want to spend a whole lot of time on this, but as you can imagine, this type of information is on our website. Broker services, you know, there's a fax number if you need to send in your email, but you should be able to track this down on our website. There's our website again, Coventry-Medicare.com. Talked a little bit about the iPad enrollment already, but I've got a lot of good documentation on that. So like I said, I got some good information. If you want to send me an email, I'll get it out to you. Customer service, like I said, they're great for those really specific benefit questions, premium receipt, express scripts. There's some numbers there if you already have some people on the books. MHNet, I'll just say they handle our mental health. I don't really like the provider directory we have as much with the provider listings. MHNet has their own website and phone number. That's who I would contact, especially you see a lot of utilization with the special needs plan. They tend to go to mental health more. So keep that number in mind, and that, especially if you're going to sell special needs. You see some first health Part D questions. I don't personally do a whole lot with the PDP, nor does Amy. We have our own team for that. So there's a phone number. I'll just say LifeScan. You know, our plans, we do give you a free monitor, so you see a phone number there, and usually that's in the member's guide. But just to be aware that we do have a free monitor for our members. Just some other information. No need to write this down, but just some addresses for your payments, pharmacy claims, medical claims, appeals and grievances, and you've seen a lot of this stuff on AHIP. Hopefully, a lot of these numbers that you see on here, you won't have to deal with very much. But if you have questions on this, just reach out to us or broker services. So just as far as presence, Harrisburg and Pittsburgh are our main offices. We do have an address there in Plymouth Meeting, but that's going away sometime next year. We'll be moving to Bluebell. But that's in that area, it's mostly our provider contracting. So as far as local exam, I'm just bringing that up because that's brand new this year, and I know a lot of you on this line maybe weren't able to go to one of our kickoff events. So if you haven't received or didn't go to the kickoff event and do the 20-question test, either reach out to myself or Amy, depending on where you live, We will email that to you, and I can promise you it's very easy. Once you're ready to sell, you'll have access to the supply portal, which is in your broker portal. You can't miss it. And that's, like I mentioned, is where you can click on print your AWN to be able to tell if you're ready to sell. That's the most important thing. You want to make sure you get paid before you sell. And that's just what we call it, ready to sell. So from here on in, I'll just open it up to questions to see if, I tried to be somewhat quick, but hopefully efficient to cover all areas and maybe pique your interest in certain areas more than others.
Well, Paul, you did a great job, great presentation. And what I'd like to do right now before I tie everything up is if you do have a question, please type your name in the question field. I will unmute you on the webinar, and you can ask Paul your question directly. So if there's any questions, please type your name, and I'll unmute you, and we can go from there.
Yeah, and I'll say one more thing before I open up for questions, because Vince, I love Vince's approach on the phone. And you know what? Believe it or not, I'm probably one of the few guys on my side that actually not just gets it now, but it got it a while ago. Now, we don't have the ability to send an email link, so to speak, to sign up a member. But I'll tell you this. If you go on our Coventry-Medicare.com, we have what's called our plan finder. And I already mentioned that to you. It's meant to be ideally for the member to be at home by themselves and do the application. It's meant to be very easy and to plug in your agent writing number. But there's no reason why, if you have somebody on the phone and, you can do that application with them via phone. Vince has his own style, but, there's a lot of good conference softwares out there. I know I like joinme.com. I think it's free, and you can basically, within 10 seconds, log somebody in, share the screen with this person, and do the application together online, and plug your agent writing number in, and you get the credit for it. So,
and Paul, I'm actually glad, not to cut you off, I'm glad that you brought that up, because I know that a lot of you, not only on this phone call, but a lot of you have contacted me or been in my office speaking to me about how you can expand your business and obviously the model of your business. And, the technology that's been there almost forever, since the beginning of Medicare Advantage with United Healthcare and Humana, is now starting to be developed by many, many companies. Not that all of it is the same. Every company has different versions of that software and e-application or voice application technology. But what Paul just explained to you is a great way to not lose business in other parts of the state or in other states like West Virginia and Ohio to local agents there, now that the scope of the area of Coventry is so much larger than just Western and Central PA. And one other thing that I will, it doesn't look like there's any questions coming in right now, but one of the other things I do want to remind everyone on the call about is that each and every one of these webinars are being recorded and strategically placed under our senior care page on our website. So if there's any agents that are under your hierarchy or any additional information that you need in the future, you'll be able to go onto our website and hear Paul's presentation from our website, from the horse's mouth. And of course, obviously, you can call our staff here, Karen, Janine, Alyssa, or myself here at URL for any additional information. And one other thing I wanted to talk about, talking about strategy for this upcoming AEP, those of you that were at the Hershey Large for our URL Leaders Conference noticed, obviously, during my presentation for filling in basically for United Healthcare, who decided not to come, we have an opportunity here right now with the special needs plans with Coventry. After reviewing their plan, it's an unbelievable opportunity to take the people that are going to be losing their coverage on the United Healthcare special needs plan and flipping those people into the Coventry policy. And that should be a focal point for most of you agents as well as the agents that are under you. So really take advantage of a program that is expanding and has great benefits. So with that being said, we do have one question here. Let me just see here. Bear with me for 2 seconds. Okay. Colleen, are you there? Colleen? Okay, but to answer Colleen's question here, basically she wants to know if she can get a copy of this presentation. I read the bottom, they only have speakers. Sorry about that. Yes, you can get a copy of this presentation not only from Paul, but you can also get it, give it about 24 hours, and it will be under the Senior Care tab under our website. Thank you for asking that question. Okay, let's see here. Okay. Okay, and we have a question here from Keith. So, Keith, bear with me for 2 seconds. Keith, can you hear me? Hello, Keith. Oh, no mic again. Okay, not a problem. What Keith wants to know, Keith Kaufman wants to know, could you discuss the high deductible PPO plan that they don't seem to cover in these presentations?
Yeah, well, you
Any
know what, I'll
information?
tell you what, I believe he's talking about the Advanced or Elite Plan PPO, and I got to tell you, we don't have it here in Eastern PA, and for some reason, it's not talked about very much. It is in certain parts of the Central PA, and I got to tell you, it's just, I'm assuming it's not sold very much, if at all, and there's probably a reason why it's not on there. So my only guess is they're better served with some of the other plans, but if he had specific questions, you know, like I said, I wouldn't be surprised at some point it goes away, but you know, it's just not pushed. But if you had specific questions, if you think maybe something like that would fit with their clients, you definitely want to call Amy Knight, and she'll be able to help you with that particular plan.
Okay, great. Okay, so we have our next question. This comes from James Howard. Is the plans in Western West Virginia on the SNPS Advantra, on the SNPS plan?
Yes, like I said, that SNP plan is in 47 counties, and it is in, I won't say all by any means, but it is in a lot of your major counties from Eastern PA all the way over to Western PA. Absolutely, with the same, it's basically the same benefits across the board. So
I think he was asking about West Virginia.
Oh, that I don't know. No, I'm going to say no as of right now because we're just going into West Virginia this year. I'm not 100%, but my guess is no. If you want to shoot me an email, whoever wants to know, and I'll find out for you. It's just not my territory, and it's our first time in that area.
Right, and I figured that anyway. And James, to answer your secondary follow-up question, yes, it's just the MAPD, which I believe is, and correct me if I'm wrong, Paul, is expanding into 22 new counties in West Virginia. And one other thing I want to also talk about, since we're talking about West Virginia, and those of you that were at Hershey that heard Bob O'Connor speak about this, you know, one of the things that Coventry was smart about when they left the market 6 years ago was to keep their doctor networks and hospital networks in place. So they didn't dismantle them when they left the market 6 years ago, almost basically telling the future that they knew that they would come back into the market. So those doctor networks in West Virginia are just as strong as when they left them 6 years ago, and that's very, very important. So yes, the product is newer in those counties, but it's as if it pretty much never left the area. So it's going to be a very, very competitive product. Next question from James Locks. What 20-question test did Paul mention? Paul, can you just talk about that 20-question test a little bit more?
Yes, it is, because it's confusing. This is the first year we've had to do it. It's been confusing, to be honest, with me and for everybody. But for some reason, it has to be done. So once again, you have when you do online, you're always going to see your AHIP and then your Coventry core, which maybe some of you have seen in the past. It's 40 questions. This year is a 20-question. We call it more of like your local product test. So if you were not able to go to one of our in-person trainings or kickoff events, okay, you need to, we're going to get you an email, and it has like a presentation attached to it and a 20-question test that you can either do online right when you open it up, or you can sort of print it out and fax it in. Most people do it online. So there's no time limits. It's not as strict as maybe some of the other testing. It really is meant to be easy for you. And you do have 3 chances. So if for some reason you were to fail it the first time, just reach out to either myself or Amy, and we'll make sure and help you get through it the second time. But like I said, if you haven't done it in person yet, we have to get it to you via email. So, you know, you can reach out. It doesn't matter. You can email me. You can email Amy. That's probably the best way, and we could email it out to you. Or maybe we'll get a list from Vince, you know, on top of it. I just like to cover bases, you know what I mean? At the end of the day, if it's urgent to you and you haven't done it, shoot us an email. We can get that right back to you pretty quick, and it shouldn't take you more than 15, 20 minutes. It's meant to be easy.
Okay, fantastic. And we have one more question here. This comes from Tracy. When you sign into the ad builder, do you use the same information as when you sign into the broker portal? I have not been able to sign into the site.
Yeah, it's a good question. Unfortunately, it is completely different. And just keep in mind that ad builder, when we have a service like that, that's not really, it's us hiring a vendor to do it for us. So it is a completely separate username and password. I know some of you are newer, some of you are not. So it can be easy sometimes to overlook that user and password for that. But the bottom line is this. The best thing to do is send me an email or Amy, depending where you're at. I will get out not just the link to that, but I will get you the contact number for the vendor where you can call up and say, hey, my name is so-and-so, I'm a Coventry broker, and they can, in most cases, reset your password and get you your username.
All right, fantastic. All right, well, listen, if there's no other questions, Paul, I want to thank you very, very much. As I mentioned, you can contact Paul with any additional questions. Check for the recorded webinar if for any reason you have someone that you want to review it with or that you missed. That'll be on our website at urlinsgroup.com. And for those of you that aren't aware of it yet, my contact number is 717-540-5690, extension 155, or my cell at 631-742-7514. And I'd just like to thank everybody for taking a little time out of your afternoon to join us today. Paul, thank you very much.
Thank you.
For those of you that are still on the call, remember, we do have our next segment of our webinars, which is with Mutual of Omaha, I believe, on Thursday, same time from 2 to 3 o'clock. So try to make some time for that as well. Thank you again, Paul. I appreciate it.
Take care, everybody. Have a great day.